Hello and good afternoon. My name's Al, and uh, just wanted to hop on for just a few minutes to discuss spinal steroid injection I had earlier today. It was the fourth one I've had, and I realize there are people that are reluctant to get them, thinking that it may be painful, it may be uncomfortable, and I just wanted to hop on and reassure you that it's no different than having a blood draw in the doctor's office. Probably the pain is, you at that level. Certainly not anymore. Um, just to give you an idea how it progresses, I go into the office, pain management clinic here in the town I live in, and check in obviously at the front desk, and was only there a few minutes. This is the second time I've used this doctor, and he's very, very good. But anyway, took me back into a room and went over my medications. You have to make sure that if you're on a blood thinner, you discontinue it, at least a week to 10 days out from the injection. Also, you cannot, in my case, I could not take any omega 3s, which I take daily, so I had to stop them. They asked me if I'd had any vaccines, specifically the flu vaccine, within the last few weeks or few days, and I had one 3 weeks ago, and I was fine to go ahead with the injection. They take you back into the room. They use a fluoroscope to see where to put the needle. Put you up on a table face down. Your face is in a padded, mine was in a padded cushion type situation, on a metal table. Do raise your legs up, put a pillow under them, so you're comfortable there. And also, I think it helps elevate your back and get it in a better position for the doctor. So get everything ready. He comes in. We were discussing it, and like I said, I'd had a similar injection a year prior, and we talked about that and how well I'd done with it and how it had relieved my pain 100%. Then he, gets ready to go. He's suited up. He's got his mask on, his gown, as do all the technicians, and he gets the fluoroscope in position. He gets all the injections ready. So the way I understand it, the first injection is local anesthetic just to kind of deaden the back before he actually puts the needle in. It goes into the epidural, or uses the epidural. It's a very, very thin needle, but so when you get ready to go, he tells you, and tells you to feel a little prick, which you do, and that the numbing solution will burn a little bit, which it did, and it was not uncomfortable whatsoever. And then he actually begins the process of injecting the steroid, but before he does, he puts the very thin needle in, guided by the fluoroscope as to where the solution is going to go. And he's telling you the whole time what's going on. No discomfort, no pain whatsoever, maybe just a tick of pressure. When he then tells you he's going to put in a dye solution so he can make sure the needle's in the proper place. So, no sensation. I had no sensation when that was going in. He then tells you that, he's injecting the actual steroid. And he does tell you, you may feel some discomfort at that point, either through pressure, or if by chance it's too close to the nerve, you may feel some discomfort there. But in my case, nothing at all. I felt, really didn't even feel the solution going in, to be honest with you. But I think there's two different vials of solution that they put in, because based on what he was telling me. And, he says, I'm finished. He pulls the needle out. You don't feel anything. Asks you to sit there on the table for a few minutes, which I did. And then hopped up and checked out and was in the car. And on the way back home from start to finish, I was probably at the max in the doctor's office 15 minutes. Like I said, I've actually had 4 injections over the last 3 or 4 years. First two, honestly, we're at a different doctor, and I guess he probably missed the right location because I got no relief from it. But I'd been having have stenosis of lower spine and arthritis, and had discomfort in my left leg when I was walking for 15 years, and to the point where, very difficult to walk any distance whatsoever. Really 25, 30 feet. Just once I did that, I would have, enough discomfort in my leg. I'd have to stop and let it ease off before I could move any further. But when I went to this particular doctor, a year ago, and he got the right spot. This last injection I'd had lasted for a year, almost to the day, and gave me total and complete pain relief. Like I said, I had one this morning. Giving it time to take effect, and hopefully it works just as good. But I just wanted to hop on and just let everybody know there's nothing to be afraid of whatsoever. I mean, there are risks, just like there are risks in everything else that you do, where any kind of invasive procedure is you go through, whether it be, a little bit of bleeding, possibility of infection. At a rare instance, I guess they could, nick a nerve or something. I think it's very low incidence, but I've had nothing but great experience, and just wanted to encourage you, if you're, having the kind of pain that I was, or if one of the doctors recommends, spinal epidural steroid type injection, that there's nothing to be afraid of. It's very easy, and I don't think you'll regret it. So just hope that little testimony helps some of you make a decision that really will improve your life. Okay, so have a blessed day.